work session of the Douglas County Commission. Today at our work session, we'll have a presentation of a draft of the Housing and Homelessness 5-year strategic plan. Just a reminder for anyone listening in or here at the courthouse, our work sessions are for informational purposes only. We don't take any action during our work sessions. If you have public comment about anything at the work session, we do not take public comment during this time, but you're welcome to come to our 5:30 business meeting. And with that, I'll turn it over to Jill Jolliker.
Thank you. Good afternoon, commissioners. Excited to be with you all today. Have a lot of colleagues that have been working on what we're going to share with you all today. And I want to make sure there'll probably be a few more folks joining us as we work through this presentation, but and I'll make sure that I'm calling them out throughout that, or I pause when we've kind of gotten halfway into this and some folks have time to join. But this has truly been a collaborative effort. And we're excited to show you what is, I can't emphasize enough, a draft version of this plan. So we can give you all a sense of where we're at on this work and give you a chance to weigh in early. And then you'll hear about what our plans are for the next couple months. And then a plan to come back to you all towards the beginning of the summer. So my cover memo, my cover memo outlined that this is where we're at today is the culmination of 18 months, more or less, that started with a summit, a 2-day summit that KDAD's Commissioner Andy Brown hosted on our behalf with the City of Lawrence. And the outcome of that summit and the intent to have collective impact on the issues of homelessness in our community resulted in the development of this Housing and Homeless Stakeholders Group. It's not the greatest name ever, but it's what we've got and we've stuck with it. So I've given you a nice representation of all the agencies that are represented there. For the most part, we have a lot of executive directors, but anymore we have executive directors and we have lead staff in from each of these agencies. And it's a really productive, collaborative group of folks. And I really think we are successful in terms of becoming a collective impact group. So a little more background that wasn't in my cover memo that led to the development of this draft plan is we had 2 needs assessments that were performed and were supported throughout their processes by that stakeholders group. So first we had the Corporation for Supportive Housing Needs Assessment that was shared with you all this past year, and then KU Center for Public Partnerships and Research, May, June of 2022. Coming out of those needs assessments, we were able to reflect on those over the course of a couple months and zone in on some focus areas. And I'm going to dive into those here in just a minute. But then we organized some work groups around those focus areas. And then we utilized a template that many of us that have been working on the community health plan for a good amount of time have found successful. It takes a little bit of use to, but we used a SMART+C approach. So specific, measurable, achievable, relevant, timed, and challenging format. And it's got some built-in questions that are geared towards utilizing equity, thinking about equity and the objectives that you developed as well. And within that stakeholder group, we have now gotten to the point where we have a smaller steering committee that is the leaders of the focus areas that you're going to hear about. And so the steering committee, the stakeholder group meets monthly, and now the stakeholder and the steering committee meets monthly as we get closer and closer to operationalizing this plan. And you'll see that in the timeline later. So you received as an attachment to this meeting the full copy of our draft strategic plan. I know I only uploaded it at noon today, but there's a lot to get into. But I'm going to go over the overarching section of this that gives you information about what is guiding the other areas of the plan, all the areas of the plan. So this is our goal statement. And really the goal statement is that we're going to have a strategic planning framework that addresses homelessness and the needs for affordable housing solutions throughout Douglas County. It's pretty straightforward. Our overall objective by 2028 to create a system that achieves functional zero through policy, system, and environmental changes, resulting in all Douglas County residents having access to the fundamental human right of safe, accessible, attainable, and affordable housing, in which homelessness is a rare and brief occurrence. To reduce disparities and optimize equity, we have identified these low-income populations that will be the focus of our efforts, where we know that there is a presence of disparities. So I'm not going to read all these for you, but if you recall back to the data that was shared with you in those needs assessments, and there's also data that's reflected in our annual point in time count, the community health plan, we think this is a very reflective of the populations that we need to be focused on. Just one little note that our group continues to, we talk about this plan at each of our monthly meetings. And one little tweak that we made this week was we wanted to make sure we were really specific up there towards the top, and then we added in low income to get even more focused on the populations of folks that we truly are focusing on these categories of folks within our low income community. Strategies that we're going to utilize to engage this population in influencing and shaping the plan. Of course, use trauma-informed holistic approaches throughout the development of policies and procedures. We'll comprehensively review the various land development codes and county regulations that create barriers to the development of programs and services. And then we will engage and empower individuals with lived experience in all aspects of planning in the programs. And you'll hear some more about that later in this plan. So now we're going to look at our focus areas. And one thing I want to orient folks to is how these focus areas, our priority focus areas, are organized. And I was trying to find an image of reflecting that we are going to invest upstream to have downstream impact. So this one struck my fancy. So the way we have these organized, you have equity and inclusion sitting at the very top, and that's there intentionally because we believe that if we have equity, if we have an equitable and inclusionary approach to this plan, then it's going to benefit everything that sits down below it. And it will have the largest upstream effect, and we think that's where we have the best opportunity to impact the other levels of this plan. Our next one below that is affordable housing, supportive housing systems, and then at the bottom we have emergency shelter. So just one more little illustration here is, and I think a lot of you all know this, I like this image and this little snapshot from an article. Just this is a systems thinking perspective, and like climate change, homelessness requires system change. And homelessness is a symptom of a larger problem. So I know I'm preaching to the choir here, but I think as we work through developing our communications plan and our engagement strategies with our community, these are the things that we have to get folks oriented to thinking about. So I'm going to talk a little bit about the why behind selecting the focus areas. And again, it was pretty easy because we had the needs assessments, and we really felt strongly that we needed to have those needs assessments to know how do we create the plan? What do we need reflected in that plan? And so I pulled just a few things out of a couple of the two needs assessments. I'm not going to read all these word for word, but racial disparities, we know that they exist and they need further attention. Gender disparities, the gender disparities, especially for females, is disproportionate in Douglas County compared to the state and the national level. And then recommendations to explore opportunities for engaging individuals with lived experience of homelessness to provide decision-making input. A couple more, moving on to affordable housing. Some of the key notes were just pretty straightforward. More affordable housing options are needed. There's some additional information about the challenges that are, I think a lot of folks are becoming very well aware of around access to the challenges that are faced by low-income renters and the partnerships that we need to cultivate further. That we have a deficit of population-specific housing options, and then there's poor perception of voucher holders. Again, I think there's been a lot of progress since these two needs assessments were developed, and the conversation is shifting. And there's folks in this room that are helping shift the framework on that, and we're already making progress on this. But our next focus area is the supportive housing. Permanent supportive housing options are needed. We don't have any, and we need them. And in Douglas County, there's an estimated need of 381 total units of supportive housing. We shared with you all during that needs assessment the different categories of folks that are in that 381. And you will see in the draft objectives that our numbers are reflective of the priority populations that we've already been thinking about as we work through this plan, and chronic homeless population probably at the top of that list. And then systems, a complete picture of the population experiencing homelessness is needed. This is a challenge that we've had top of mind for a good amount of time. Our homeless management information system has not been an accurate snapshot of who's experiencing homelessness, who's at risk of experiencing homelessness, who's transitioning in or out of homelessness. It hasn't been a good resource to us, but there's no reason it can't be. And so that's a huge focus, how we invest in HMIS, expand access to it, and you'll see that in some of the strategies as well. A little bit more here, continued and increased collaboration across the providers is needed. We've made a lot of progress on having a really full table, so to speak, with coordinated entry conversations and with similar conversations with our Built for Zero team around building that by name list that supports a more robust HMIS system and a data system that truly reflects who's experiencing homelessness. But we've got I think slowly we have a even more full table, but we need more folks utilizing that system and finding it helpful. And then our last focus area is emergency shelter. The needs assessments didn't call anything out overly specific to what we needed from an emergency shelter perspective, specifics, but it did call out some things that I think are very true today. It talks about the county and city funded efforts, including continued funding needed emergency shelter resources, particularly the historic partnership on funding the Lawrence Community Shelter, and the efforts that have happened the last couple of years on the behalf of the city in terms of standing up a winter shelter. And then when housing costs are more affordable and housing opportunities are more readily available, I like this quote right here, which comes from the federal strategic plan to prevent and end homelessness. And it's just kind of another illustration of how when we look upstream, invest in affordable housing, we see benefits downstream. And what I hope we can get to, especially when you look at some of the draft goals or draft objectives that we have with emergency sheltering, I think our plan is that at the end of the 5-year framework we don't necessarily have a whole lot more emergency shelter. We might have less, but we have more intentional spaces for folks, and the designated services and resources available and appropriate places for those folks, more so than maybe we have today. Okay. Before I start talking about specific objectives on the focus areas, any questions? I was going to pause for a second. Nope. Okay. So I'm going to take a very broad strokes approach to the objectives. There's a lot of information in that draft plan. And so when you ask questions, we can refer to that. I also have Marielle Ferrero and Lacey Rose also in the audience as well that have led this work group, and there's been additional partners and participants in that work as well. Each of the work groups meet on a monthly basis. A lot of hard work going into all these work groups. So by 2024, operational goals are established to inform all areas of the strategic plan that are utilizing an equity lens. Similarly, a communications education event and resource planning for the community that is focused on equity, diversity, and inclusion as it relates to our houseless and our housing insecure communities. And that expertise advisors are working within all areas of strategic plan, and that they're being compensated for that work. By 2025, we have equity-focused data collection and performance indicators to measure our impact from an equity perspective. By 2026, we have some an equity-centered decision-making model to inform policies, which could include budget investments, processes, procedures, and practices. We have some policies and projects that are identified to integrate with the existing and future projects that are underway that demonstrate progress toward our equity goals. And then by 2027, we have we are able to do some organizational assessments and supplemental training for local agencies and local governments that are supportive of equitable outcomes, inclusion, and diversity as it relates to supporting the population that local government and our partners are charged with doing. Before I move on from this, any specific questions? Marielle, do you want to offer anything before we move on? Okay.
Joe, can you talk, or someone here, a little bit more about that last one when you mean supplemental training for local agencies and local government? What does that look like?
Switch her out. Sorry.
Has to be on. Okay. Hi, Commissioners. This is Maria Ferreiro with the Focus Group for Equity and Inclusion. So looking at the organizational assessments and supplemental training, what we're really trying to do is get some cohesive ideas and training throughout all of our social service agencies and government agencies to primarily be on the same page when it comes to how we're not only talking about equity and inclusion, but how we're actually performing that. And within organizations, we know that various social service agencies have a level of training and competency that they require for their agency, but how, again, can we all kind of get on the same path and make sure that when we are communicating to the public, to the community, that we can all come from the same page and we can all be a little bit more united in that. And I think that will help with these various assessments and trainings, will only help further the goals of the rest of the strategic plan. So that's really what we're looking for in training. And we know it'll take some time, of course, because everyone has their own ideas. It's a very broad topic and sometimes a little subjective to measure. So how can we be a little bit more intentional? That's what we're looking at.
This is Commissioner Reed. I appreciate that, and I'm always a fan of same pageness and an attempt to create as much continuity as possible. Is that something? And I know, this is a long-term plan, but also time goes fast. I sort of assume, but maybe the assumption is wrong, that some technical assistance might be sought in that process, maybe on a national level, to really help both sort of assess the landscape of social services and human services and what their policies reflect in terms of equity issues. And then, from a sustainability perspective, is the goal that through whatever technical assistance there was, you could sort of have some, I don't know, like a train the trainer piece of that, so that there are some key folks throughout the community that are, that can help carry that on. And especially as somebody who works in nonprofits, like really respond to the sort of turnover that is inevitable. Is that part of the plan so far?
Yes, I think at this point in time, what the group is looking at are those national groups, the research and case studies that have gone into what is effective training, what are effective assessments, where are we now, and how can we be better? And I think a key of that is the sustainability of the practice, because we do see a lot of turnover in our agencies. We do see a lot of ebb and flow of representation in organizations. And so I think figuring out who can maintain this training, championing our local organizations, local governments to kind of take that charge when they receive and pass that down. I think it's always a great opportunity to build redundancy wherever possible. So if we can get employees, if we can get organizations empowered through this shared vision of what that assessment, what that training looks like, then we empower them to continue that down the line to their employees and just like you said, create some more cohesion.
Great. Okay. All right. Before I move into this, I'm going to make sure I move. So affordable housing was led by, so I'm going to move Leah Roslin into the panel. Robin, unless you're able to, or Sarah, are you able to move Leah into the panel? If there's questions that she can answer, in addition to Gabby Sprague, who both led this focus area. So what's on the screen is in the plan, but this gives you kind of a visual look at the goals that are in the affordable housing section of the plan. So there is you see goals here for within 30 to 60% AMI to have, sorry, I'm have to orient myself here. 1,125 that are 30 to 60% AMI in the affordable rental category. And then 375 of those are for below 30% AMI, again, just for the affordable rental unit. And that is the goal for 2028. Included in that affordable rental, the hope is to have that at least a third of those rental units will be 2 to 3 bedrooms. And then moving over to the goals for affordable home ownership, the goal is to have an additional 400 that are targeted to folks with at 30 to 80% AMI. 200 of those folks are 60 to 80, and 200 of those folks are at the 30 to 60 point. Within that 400, the hope is that there is at least half of those are represent an increased supply of accessible, affordable units for seniors and people with disabilities. Beyond those numbers, number goals, those charts, the additional objectives there that are up here on the screen are to develop a 10-year affordable housing strategic plan, and that there'll be systems change that realigns power imbalances, preventing access to or development of affordable housing. There's a lot of good information that's in the full version of the plan. And then I would open it up to any questions or any additional information that, Leah, I might put you on the spot just for a second, just to maybe address in your role how you see the work of this plan aligning with the work of AHAB and the work that and the goals that AHAB has.
Sure. Good afternoon, commissioners. As Jill stated earlier, collective community impact is a value and priority for this plan and those of us doing this work. And so that is happening in a couple ways. The first is through alignment with the AHAB Affordable Housing Advisory Board goals. The AHAB just held their retreat where they did their next 5-year goal setting a few weeks ago. And in addition to looking at the recommended goals and strategies in the 2018 housing market analysis, we also looked at the goals and strategies and action plan for this plan, and that really helped the AHAB to align. So they did move to essentially adopt these goals and strategies as AHAB goals and strategies. So we'll be able to leverage, the Affordable Housing Trust funds and the policy work being done in the AHAB to further our goals in this plan. I hope that addresses the question. And then I guess I should also say that it also further aligns with the City of Lawrence strategic plan around our goals for homelessness reduction and affordable housing, households being cost burdened by housing, in addition to numerous other elements in the City of Lawrence strategic plan, such as infill development, et cetera. And I'm happy to address any other questions you may have. Thank you.
Gabby, anything you want to add before we move on? Okay. Oh, go ahead.
So if you could just be a little bit more specific. We've talked about it a lot in here on power imbalances preventing access to, and I know we've discussed that a lot in here, whether that's tenant representation or working with landlord. Just for the public, in case that's the first time they've heard that, could somebody expound on that a little bit?
I can speak to a couple of the strategies that we have in here regarding that specific item. So we also have provide recommendations to the Land Development Code Update Steering Committee that's currently happening at the City of Lawrence. Establish tenant legal representation, which you mentioned. It's source of income discrimination protection, which has already happened, but still continues to be a work in progress. Establish an ordinance commonly known as a vacant structure ordinance, which would allow City of Lawrence to seize or otherwise remediate the issue for properties left vacant. And we did establish a couple more that we're still kind of building out the sort of action steps we're going to take for that. But we have developed targeted programs that increase racial equity and affordable housing access and home and land ownership for Black, Indigenous, people of color experiencing housing disparities. Another one is create increased opportunities for community ownership of land and property. Another one is increase community capacity for permanent affordable housing development by identifying and supporting an additional community housing development organization, and particularly looking at does community ownership of property and land in our community look like as another sort of move towards correcting those system imbalances that's stated in that strategy or goal.
Thank you for asking that question, Commissioner Kelly, and thanks for giving a good list of some examples. I'm curious also if along with the land development code and therefore and then code enforcement, ultimately conversations that are happening around development of affordable housing. I'm curious if any of the strategies have touched on rental licensing at the city and what that looks like currently, what it could look like, what layers of accountability might be baked into that. I'm just curious if that's part of the conversation. And then also it's probably well, maybe that's a question for Leah. And then the other thing that came to me just left me, so I'll just leave it at that for now. That happens.
Leah, I see you have your hand raised. Do you mind tackling that question?
Yeah, I apologize. I had raised my hand before that question came up, but we did not incorporate rental licensing into the plan, but thank you for bringing that up, Commissioner Reed. And I think that that's something good to take back to our group to think more about incorporating into the plan.
And the best part about this plan is that it is a living document and we can always add things at any time. And I think that's a great suggestion.
I just wanted to make one point about the power imbalances, and perhaps the commissioners have some suggestions or thoughts about this. As an additional thing that we were thinking about is what happens I guess what is referred to as NIMBYism, or not in my backyard, when new affordable housing or supportive housing developments are proposed. What often will happen is the more privileged in our community, predominantly white homeowners, will come out in force. And that has been a really powerful group, and not just in our community, but in others. But, you know, we are not immune to this, and that has prevented really vital developments from moving forward. And so we're thinking a lot about how to right those power imbalances so that decision makers and leaders in our community, such as yourselves, can also be hearing from all of the other community members that affordable housing and supportive housing, that the need for that impacts, and how can we prioritize and I guess increase opportunities for those individuals to also participate, so that we're really hearing from the full breadth of our community, not just the most privileged who have access to social capital.
Thanks, Leah. And I think that's another great example of why we put diversity inclusion at the top of this plan. It sits on top of our affordable housing strategies aren't going to be successful unless we have what's reflective of what you just spoke to, Leah.
Leah, you asked for commissioners' input on that, and I do think there is a space in our community for, I'm going to call it leadership training, making sure that we're clear that leadership is, it's an action, and helping those in our community who may have less privilege to believe that they can lead in this space and that their voice is important, and giving them tools to sort of address when just you use the word privilege there, and I think it's an accurate one, how we address those competing values and prioritize one over another. I think that's training that sometimes gets given to some, but not to all. And it's just something to think about how we empower people to lead, and those who are in positions of power, make it easier for others to lead in that space. That's something I'd encourage you to think about. And then also, and this is something that I'm just reading a lot about recently, is just training in being kind. And I know that sounds corny, but I really think there is a space for it in, you know, what empathy looks like, what it's like to be vulnerable, what it's like to understand and listen to others' points of views, and then maybe, you know, hold space for that. That's something I don't know that we're very good at right now as a community, and something we could all continue to work on. So those are just a few bits of feedback.
I'll expand on that just a little bit. I think when we have conversations like this, we're talking about what are our responsibilities to each other, to ourselves as community, and to those vulnerable in the community. We talk about responsibilities. When we have public comment that comes forward about specifically land use items, because of the way we put out public notice, we get people who come in and talk about, you know, their rights, which are also important, but reframing conversations that rights and responsibilities are always linked. You know, I have this right, therefore I also have this responsibility, or I have this privilege, therefore I also have this responsibility. And just reframing that topic in the public sphere is something that I'm not sure how we go about that, but I think we have a community that cares. And we need to kind of keep that in front of them, that this is what care looks like when something comes forward that requires either a sacrifice or a perceived sacrifice from you or from your neighborhood or from people that you know, that it is okay for us to sacrifice for one another. That is part of that responsibility.
Okay, I'm going to move us forward to supportive housing. This is a work group that I've been privileged to lead with folks like Matthew Falk, who's at the table, and Bob Troyansky, Shannon Owery, Car Wu, I know that I think Rebecca Buford and Erica Zimmerman, and there's probably a few more folks that are in the virtual audience that have been participants in this group, and I apologize if I'm leaving you out. But having that needs assessment from the Corporation for Supportive Housing really gave us exactly what we needed to inform this aspect of the plan. There's a lot of categories of folks that were identified in that plan, but we have prioritized for the last 3 years our chronic homeless population. And so sitting at the top, you have the highest number of need is for our chronically homeless population. And then we have 2 units identified for chronically homeless families. 55 plus is the next category below that, with 50 individuals, and then our justice involved population. The identified need is 20. So these numbers that are here and are reflective of projects that are not only the needs assessment data, but also the projects that we know are in the pipeline too. So there's a lot of partners are doing that work, and we feel really confident that the strategies that are outlined in the plan are reflective of getting us towards these objectives. But they are specific, they're targeted, they're measurable, and we feel good about them. Yeah.
Jill, can you, I'm struggling with this slide because it's 3 shades of blue.
Sorry, I know. Yeah.
And I tried to just track what you said and like rewind it in my head, but I
Sorry.
think I messed it up. So the 50, is that chronically single individual, chronically homeless single individuals?
Yep.
Okay. And then the 30 is chronically homeless families, or that's the 55 plus seniors? Oh, thanks. Thanks, Commissioner Kelly.
The 55 plus is the 50.
Okay. All right. Thank you. And Commissioner Kelly just pointed out that I can re-reference the packet for it, but just wanted to
Yeah,
make
I'm
sure.
sorry.
Trying to track those categories for now. Carry on.
Oh, sorry.
And Jill, can I ask real quick? Oh, sorry.
What? 30 is the chronic signal.
Like single is a funny one to say. So Jill, these are the goals for 2028 to provide permanent supportive housing in these numbers for these categories, not the total need for supportive housing within that time frame, correct?
Correct.
We still have that
Yeah.
361 or whatever that number is.
And the biggest, yes, and the biggest chunk of that number of in the needs assessment was for the IDD population, which I think there's nothing but intent to be able to dig into that population of folks as we move through this plan in the future. But that was the biggest number. Oh, sorry, individuals with developmental disabilities. One of the things we've talked about when in establishing these goals, and as we work through this plan, is there is a role for transitional housing in this plan. One of the things that we know is that Burt Nash's transitions facility has been incredibly successful. The only problem with it is that it's always full. So we wanted to make sure that we were, we deliberated and created some similar goals around our homeless single individuals that are in need of transitional housing services with substance use disorder, mental health services available, and the same for our families. So it's that number is 15 transitional housing units for homeless singles with SUD mental health needs, 10 for homeless families with SUD and mental health needs, and then 10 for our homeless child welfare involved families. The role that transitional housing plays, whether it's getting the needed services that are like folks get at First Step or transitions or perhaps other places, or you could even consider artists helping the homeless is definitely considered transition as well. While they're waiting for their next step in housing, it's absolutely needed in this community. Before I move on to systems, I wanted to real quick note that supportive housing has been, the goals that we have in supportive housing have been around and reflected in the 2023 community health plan as an overlap strategy between the affordable housing and the behavioral health planks of the community health plan. The need for supportive housing is not a new one. It's a huge deficit in the community. And so, I'd be remiss if I didn't, call out that Shannon Bowery and Bob Trayansky have been talking about the need for this focused effort on supportive housing for a very long time. And I'm happy to have some hard objectives and strategies that we can move forward with.
So Jill, we have numbers and targets for 2028 for built units that would be both transitional housing and also we have supportive housing. Do we have a partner identified who would build those, manage those, take care of those in the long haul, or is that part of the ongoing discussion that we need to get to before 2028? That's
part of the plan. So two of the biggest chunks of the supportive housing plan is to have a capital improvement, a 5-year capital improvement plan and capital acquisition plan. And as part of that, to have a operating budget that accompanies that. So we don't have any agencies immediately identified. We have some leaders. One of them sitting at the table. And I know that they wanted, this is very much aligned with the goals that Bert Nash has to do this work. So in a lot of ways, there's already a few paddles that are in the water. It's just making sure that we're building a plan, a capital plan, and an operating budget that gets us from point A to point B, but that's absolutely part of the plan. Oh yeah, go ahead, Matthew.
Matthew Falk, Director of Housing with Bert Nash. I think there's more detail to that concept. When you consider agencies like DECA and Bert Nash, you already kind of have supports in place in respect to, what we're licensed to do as state licensed supportive service providers. So they're already at the table in respect to being agencies who provide the service, are going to continue to expand that service. The challenge is building the foundation for agencies who don't already have a system to generate revenue to support that process and cover the needs for folks who are not necessarily receiving services from those agencies. So it's about really expanding who's at the table and who has capacity to provide that service. So in some sense, we already have a component of the plan in place that just simply needs to continue to grow with the agencies that exist. But we need to create from scratch processes, funding mechanisms, support for ways of providing service to people who don't fit into those categories. So it's about catchment and expanding catchment.
One aspect of the adaptive change and challenge that goes into these strategies being successful. If you look deeper into the plan, it's to develop a shared framework for housing focused case management. We've tried to start some of those efforts with the leadership of Carrie Nice, and even in the work that the Housing Stabilization Collaborative's done the last year with Gabby and Marielle's leadership. But there's a lot of divergent opinions on what it looks like to keep folks housed, to connect them. A lot of folks think sometimes it's very light touch. Some folks think it's 24/7 monitoring. We've got to figure out what's that full continuum look like, and what does it look like, and what's the county's role going to be in supporting this work at a more robust community level if we're going to hit these goals. I'm excited that we have an opportunity to partner with the Corporation for Supportive Housing for some technical assistance on a contract that we're going to start here in the next month or two, that I think is going to be a critical step to getting us towards these goals.
Thanks for that, Jill. And I just to sort of, I guess, thread the needle, I'm going to assume that, especially since we talked about equity inclusion sort of being the top of the list, and what is the lens through which all of these different strategies and work is being done, that trying to figure out, and I'm sure lots of people have a good sense of it based on the conversations that have been happening, but those sort of disparate ideas and definitions about what it means to support somebody in maintaining their housing, that equity and inclusion is a lens through which that conversation is being had, and that there's some particularly like emphasized parallel tracking of that conversation. I'm seeing some positive head nods, so I appreciate that. And I just think that is really critical. And these are they're hard conversations, they're nuanced. Agencies have different cultures, different policies, different definitions of things, and some of those differences will remain, but as much as possible, I think that the goal to figure out some real continuity and look at that through an anti-racist and anti-oppression lens in particular about what the experiences of some people have been previously and how system failed folks have been, and recognizing what barriers there are to remove. I really think that's a community-wide conversation, and grateful to hear that it's sort of baked into this strategy and how those conversations will evolve.
Absolutely. I'm going to move us through the next few slides kind of quickly, because we're getting close to our time, but our next focus area is systems. This one, I say it's pretty easy because we've been working on it. It's not easy to accomplish, but like it's pretty easy to outline because we've been working on it for a long time. Talking about our engagement, this is our third year of being involved in the Built for Zero initiative. We started it just as COVID was coming to bear in this community. And I remember talking to folks like Matthew and being like, well, this seems like no better time than any others. And, like, let's just stay on this path and let's dive into this initiative. And it's been the best decision that we've made. The framework that they utilize and the coaching that Built for Zero provides is overlaid into this focus area that you stay laser focused on quality data. So our goal here, our objective here, is that we will by 2024 have a community dashboard that provides real-time homelessness and housing service data. Housing service data is, things we're talking about is who are the providers, but also what's available. Where are beds available? I mean, would be a great resource to have. By 2025, we want to have HMIS, the Housing Management Information System, accessible for all homeless targeted programs and housing services for review, input data, and performance evaluation. Today, HMIS is not available to all agencies that work with the homeless population. We're working on it. We're making progress, but we're not there yet. And then to establish some key performance indicators about how successful we are with our data systems that are tracking our strategic plan. They're tracking the objectives in our strategic plan. They're tracking our objectives in Built for Zero. And that we're creating some community engagement and education resources so that we can talk to our community about why quality data is important. And that, talk to folks, when you talk to folks about data, you need to make sure you're talking really, about trust and how folks' data is used, and that it's being used to promote and coordinate care and maintaining folks' privacy, but that it is important. Okay. Go ahead.
So when you say HMIS is not available for all our agencies, what's the barrier for that right now?
Historically, it has been the availability of licenses, because we talked last week about sitting within a balance of state. The balance of state, the infrastructure that support and the budget that supports the balance of state, they've only historically had access to a set number of licenses. So they restricted the number of licenses to agencies that are HUD funded. So only HUD funded agencies. Go ahead, Matthew.
Director of Housing, Bert Nash. I'm on some of the steering committees with the COC that talks about this and is trying to address this. It does have to do with licensing and issue licensing, but it also has to do with the COC being mindful of their data quality and understanding there are certain HUD required data qualities that are for agencies who use HMIS, and agencies who are funded through the COC in ESG are already expected to meet those standards. And there's a mechanism to ensure they meet those standards, i.e. their funding. For agencies who don't receive funding, which is really the target area, they're concerned that there's no mechanism by which they can ensure data quality. That's one concern. The other concern is, technical assistance, right? Administrative capacity to run the HMIS, to manage a large amount of onboarding of new programs and to build new programs. Each new program that you bring on to HMIS may not fit into one of the categories of program that already exists. So then you have to have capacity to program and build within the HMIS system function to serve that program. So there's internal capacity to just do the administrative management. There's concerns about data quality. There's a few issues that are being discussed at the COC level. And we're trying to figure it out. But it is a concern, and there are folks who are kind of saying, hey, no.
Yeah, so I appreciate that we're trying to figure it out. This sounds like bureaucracy and the number of acronyms you use there, Matthew, probably highlights how bureaucratic this is. I mean, these are the things that I think really frustrate people is all of those things are understandable, but we've got to work through that to get all these agencies on board. And I'm just really interested as you all continue to develop this, how we can leverage, whether through funding or through policy or through partnerships, to break up that log jam, because that just seems like such a critical piece, that everyone is sharing the same data. I'm not blaming you, I'm blaming the system, whoever that is, and we're part of it. So yeah, just maybe venting a little frustration there.
So, I mean, there are repercussions for example, for having poor data quality. HUD rates our annual statewide application based upon a lot of quality points. So there are concerns that if we're a little loosey-goosey, then we're shooting ourselves in the foot to be available for wider funding because our scores go down. So again, it's nuanced, it's a little complicated. I'm a proponent of bringing it on. I have programs that can't access it that I would love to use for it. But probably doing a lot of outreach and facility and money talks. So if there's money to support administrative help for the especially with the Homeless Coalition, and I know the county's being very generous and really stepping into that arena to help them, and we really appreciate that. But that I think will help move the conversation along.
Good. Yeah.
Gabby Sprague, Housing and Human Services Program Manager. Yeah, to your point about the bureaucracy, those things also cause barriers to people accessing assistance too. Like if we had to require, there's a thing called a VI SPDAT, which is a test that takes about 15 to 30 minutes, or a survey rather. If we had to do that during the middle of the pandemic when we were just trying to get assistance out to folks, that would have been very difficult and a barrier to access. So another part of this is making sure that our programs remain equitable and remain low barrier in order for people to access these things. I'm a proponent of moving everything over to HMIS, but it has to be a two-way street, I think, to a degree.
Yeah, and Gabby brings up a good point. The VI SPDAT does serve as a barrier for folks getting on the coordinated entry list, the official coordinated entry list. Now we can have we have unofficial conversations about housing availability. The Sunrise House, which is funded with some county dollars from our Housing First pilot, but the larger, have a more robust coordinated entry system would be reflective of all the funding sources and all the users. Okay, we're getting close to time. Oh, go ahead.
I'm just going to add one thought. I don't know if it's feasible at all, but I'm just curious if license sharing is a thing. I'm just going to say it out loud, and that might be not possible or sloppy if possible, but just curious if there's precedent for it. So you can just put that in the back of your head and carry on.
We can certainly ask. Okay. The next section is the least baked section of all. But to be fair, we've been doing emergency shelter in this community for a good amount of time. even though we're getting close on time, just to be safe, Sarah, could you move Savannah Fergus and Andy Johnson into the panel? They've been assisting from Lawrence Community Shelter in the development of this plan, and are here with any questions that as we dig into this. But these are the objectives that are reflected in the full plan, and I try to make like a just a visual image of what those objectives look like with this graph. And I know that the colors are not great, but the objectives that we've so far developed, and all we've got is objectives so far, but the objectives are specific. They're focused on key populations that we're thinking about, because we know that the data is telling us that there's a greater need or there's disparities. If you look at the full document, the first objective is that we will increase the number of low barrier non-congregate single female adult emergency shelter beds by 30. So the top right big blue 30 section is for our single females. But then our next population of folks that we've identified is the 15 that's there is our youth. That's the 15 just below that blue. It's the blue 15, the dark blue 15. I apologize. And then the next one is for non-congregate emergency shelter beds for individuals fleeing domestic violence, human trafficking. That's that next 15 that's there. And then I would like to pause for just a second on we have a one that's in here that I'm not excited to have it, but it's important to have it. And I think our friends at Lawrence Community Shelter are uniquely qualified to talk about the need for medical respite care beds. We've identified a need for 10 of those. Historically, folks that are in need of medical respite care that are houseless and have had a surgery or been hospitalized for whatever reason don't have a place to heal. Or in some cases, they don't have a place to pass away. And Lawrence Community Shelter has stepped into an incredibly challenging but important role historically in providing that. So Savannah or Andy, would you talk just real briefly about why that's important that we have that in this plan?
Absolutely. Andy Johnson, Director of Finance and Operations at Lawrence Community Shelter. Medical respite is something that is definitely lacking in our area. What we need to look into is whether this is something that it's an opportunity for great community partnerships. Because right now we will have folks who are discharged after an injury or surgery or even an illness, and then they come here, and this is not the place to try to heal, especially if you need home health care, regular visiting from nurses, things like that. We don't have, there's not an opportunity in a congregate shelter situation for privacy. Sometimes even just being able to access an electrical outlet for medical equipment. We have used Monarch Village units for that, but it's beyond our scope. And trying to have people come out here. We've also had, I believe, Jill, you mentioned hospice and having a place for folks to go and receive hospice care. And that's something that can be really challenging in our area because there's not a hospice facility. And so hospice is home-based. But where do you receive home hospice care if you have no home? And we have sheltered 2 individuals most recently in hotels for hospice care. We put them in hotels so they were able to get that end of life care. And that's no one should have to die alone like that.
Thanks, Andy. I appreciate that.
Sure.
My point with that, and I know we're going to wrap this up, but the identified populations that are in those objectives, we are specific. We're thinking about populations of folks that we know we're seeing in this community today that don't have access to specific spaces, females, families. We talked about folks with medical needs. We talked about youth. we know we need to have dedicated spaces for those folks. A lot more work has to go into how many we need at the end of this timeline. We don't need to grow the number of, right now, we're not thinking that we need to increase the availability of the sheer number of emergency shelter beds in this community. It's just the mix and the dedication of who they're directed towards, that we have a lot of work to do in this space. Did you have something, Sarah? I'm
Well,
sorry.
I was just going to mention that, where is the intersection between respite and the availability of Medicare nursing beds in Douglas County? And, which they're like, that availability is zero. So like, where is that? How do we bring our other aging partners to just have that conversation and raise that issue? Because I just think that is a very non-visible houseless situation that's incredibly challenging to resolve.
Absolutely. I don't know
And-
how many times I hear people on coordinated entry case coordination talking about, we're just waiting for them to get into a nursing home. Yeah. Our last couple goals that are here, 2024, we're going to have an established community severe weather emergency shelter plan. This is an easy one because the city's doing it and we just want to document it. And I just kudos to the city of Lawrence for leading the way on this. We're going to have 3 lead agency community access points. We have a whole lot more access points in this community to get connected to coordinated entry, but we want to have 3 lead agencies that, like, every citizen or most citizens, certainly our commissioners, can say, these are the lead agencies. This is where you go to get connected to coordinated entry resources if you're houseless or about to lose your housing. We want to have a 5-member multidisciplinary street outreach team that is supporting our homeless community. And we want by 2027 to have increase by 2 to 3 the community outreach and day center facilities. So folks have a place to go, connect to services, and a safe place to be and be well and connect again to providers during the day. Where do we go from here? Oh, real quick. So I said this is the least baked. There's a lot of work to be done in here, and there's a lot of evolution happening in this space. And I think a lot of folks know that. Some of y'all may be wondering, well, you didn't talk about the pallet shelter camp. This is going to be part of it. How we get to these goals, pallet shelters, just one of many strategies that we are going to have working in our favor. And I'm really excited to be working with my friends at the City of Lawrence and other partners. Where do we go from here? We're here today. There's a presentation to the City Commission next week. Between now and then, our work groups keep meeting monthly. They keep refining their plan. Like Gabby said, it's a living document. We're going to continue to take the feedback from the group members and the feedback sessions that you'll see coming up next. We have 3 sessions that are already scheduled. You'll be getting information about that soon. Huge amount of thanks to our friends at the City of Lawrence. I know Hannah's here, and leadership from Leah, Roslyn, and Carrie Britt, and others that I'm forgetting on developing a really great plan for these community engagement and listening sessions. And we're going to have our stakeholders, all the folks that you've heard from today, helping us facilitate breakout sessions and all that good stuff. So we've got a virtual session coming up first. We'll be getting signups and all that to folks. We're going to have 2 in-person sessions, one on May 5th at the Union Rail Depot, Union Pacific Rail Depot. I probably got that name wrong. I apologize. And then we have one at the Lawrence Public Library. And then we're targeting either mid-April or May to have a virtual session with the Lawrence Association of Neighborhoods. Then we come back to y'all. We show you how we've taken the feedback from all those sessions and how we've incorporated into the plan. We ask for your approval, and then we hit the go button and we move into operationalizing the plan. I've talked about a lot of these folks that have been involved in this plan. I did not talk about, I don't think either of them were available, but the systems group, Shanae Eggert and David Tucker, we also have Matt Cravens, our data analyst with the county has been involved in that, along with a lot of other folks. There's folks that are on this list that aren't on this list, and it has truly been a collaborative group. The city and the county, of course, has been, convening folks along the way, but we couldn't do this without all of our partners. And I'm really proud of where we've gotten with all of our partners. And with that, I appreciate everybody's time. I'm sorry I didn't leave more time for questions. Okay.
I don't think I have any more questions, commissioners. No, oh, go ahead.
I don't have any questions, but just want to appreciate the level of detail that's in the draft. And I know you emphasize draft, and appreciate getting the opportunity to sort of dig into it now and look forward to seeing how the conversations evolve. And I really think that I have witnessed the last couple of years some really meaningful collaboration and people working to push past discomfort and also just overwhelm, which so many of us naturally are grappling with, and to talk about really difficult things. And I just appreciate the tenacity of everybody really staying engaged in the conversation and bringing their perspectives and their skill sets. And I just think we keep learning from each other. And I'm excited about where we're headed, and that there's some meaty stuff to really do in this community that helps sustain a different kind of culture.
Okay, I just really appreciate all the work that's gone into it and the collaboration, and that it's a strategic approach. I like those goals being outlined. That puts a big challenge to us to sort of meet those goals, and I love that challenge to elected officials. So thank you for that. If there's no other questions or comments.
I did want to say
There you
real
go.
quick though, like in terms of like where we're at with this conversation at a community level and my time here at the county, like I feel so good about the county and the city's partnership in this space. It's the best it's ever been, and I'm really looking forward to moving forward. I think that city county resolution that we have to work on this plan was a good start. And we really are working towards operationalizing what that resolution outlined. So.
Jill, one last ask is if you could put your PowerPoint on our
Robin has
agenda,
it.
that would be great. We
Yep.
want to share those community sessions, and I think that's the only place I found them. So
We just set them like maybe yesterday. So we're working hard to get it all organized.
thank you. Appreciate that. Okay, with that, we are adjourned until our 5:30 business meeting.